the Department of Physical Therapy and Sports Medicine in Ortho 1 Orthopedic Specialty Center, Coimbatore, and he had also served as a team physical therapist for the Chennai Cheetahs and for World Series Hockey and for the Chennai City Football Club. Sir is having numerous awards and achievement by their name, and they have various publication by their name. So it is a matter of pleasure and honor for me to host for the Ganesan sir. Heartfelt thanks and warm welcome to you, sir, on the board. Over to you, sir.
Thank you, Himanshu. Thank you, Harsh, for inviting me again. Nice to be on this platform, and really nice to see this platform really doing so well. And I greet every physio here on occasion of the World Physiotherapy Day coming up. So I will not waste time much. Himanshu, you need to tell me whether you see one screen or...
So there are two screens I can see actually.
Okay.
Sidebar is also there, that is showing, I think, next screen.
Yeah, 1 second.
Yes, sir. Please, I am making the host again. Yes, please.
Now?
Yes, sir. Now only one screen is visible. It is on the full screen mode.
In the full screen mode, right? Okay.
Yeah, yes. So, one more minute, sir. So I would like to inform all the participants who are joining this session for the today's International Physiotherapy Conference. So I will share a feedback form in the chat box. So kindly do fill it to get your participation certificate. The one who will fill the feedback form will get the participation certificate only. So stay in touch and enjoy the learning. Thank you, sir. Over to you, sir.
Thank you. So very good afternoon, everyone. So it's nice to have the first lecture by Annamalai, and I hope I can add some of my experience and knowledge, what I've gained over the period of time with you guys. So this is some of my work which I have worked with the sports in particular. This is with my World Series hockey team, which was the second league to start in our country after the IPL. This was a work we did with the Kabaddi Association of Tamil Nadu, where they took Kabaddi into to smaller towns and districts, where we visited about 8 districts. And we worked with the younger athletes and athletes who are not affordable and who are not exposed to good scientific exposures. This is with the Chennai City FC on the I-League. They were the champions in 2018 and 19, and now they have progressed to the Asian Federation tournaments. That was another very tough season for us. We are also involved with motorsports because India, there are only 2 areas where you can have motorsports. One is in Noida, Delhi, and then the first one was in Chennai, and we have one in Coimbatore. And Indian Narayan Karthikeyan is basically from Coimbatore, so I get to meet him a couple of times on his injury management when he visits Coimbatore. Marathon is, we can see now, is catching up a lot with various towns, and there are marathons ranging from 1 kilometer, 2 kilometer, 3 kilometer, 5. So we have also been part of the Coimbatore Marathon, which is also a very famous marathon down south. These are some of my challenging sports people, and they are not the topmost athletes, I will tell, but I will say challenging. This is Vinay Baiswad. My initial career when in Chhattisgarh I was the national table tennis player. So the challenging part was he had a meniscal injury and he was advised for surgery, but he had a very important tournament upcoming, and then we wanted to put him back without the surgery, and we were able to do that. This is a veteran athlete who participates on the Veterans All India meet, and she is like 68, and we get to rehab her on and off when she comes with her injury. Mr. Yoganand, he's a business guy, but who just plays sports, tennis in particular. The important thing was he had a back injury which had put him off playing for the last 3 years, and he had tried all forms of therapy and he could not get back his back pain, but we were able to put him on a program which took us 3 months back to the field, active sports participation. This is our Indian national basketball player. She's 7 foot 2 inches. She's the tallest basketball player. So I had an opportunity to meet her, do her evaluation, and make an exercise plan for her. So these were some of the challenges you find when you treat athletes. So we all know that the physical demand of sport is too high, and you need to have cardiovascular strength, endurance, strength, muscular endurance, flexibility, balance, coordination or proprioception. Then comes your mental capacity and nutrition. So these are all the key ingredients or the areas which you will have to touch upon over a period of your management of athletes. So when you look at athletes, there is always a comparison in general when people look at who's the best, or even you can take up football or any other sports, you will have a comparison, and there's what they achieve as individuals is also a very huge component. But we have to understand the physical capacity of each individual is different, and the way they train and tweak the training will be different. So what I'm going to cover in my session is two aspects. One, I'm dividing into clinical aspect and non-clinical aspects. So in the clinical aspects, I'm going to talk something on prevention, injury management, recovery, and non-clinical, I'm looking at something at infrastructure, technology, and the career. So I've just made so that I can be clear what I want to cover. So coming on to the clinical, the injury prevention. Now, injury prevention is a very key component of a sports athlete. If you look at injuries, is it possible to really prevent injuries from athletes? Not possible. Every athlete will have some or the other injury happening to him over a period of his career. The only thing we want to do is prevent the major injuries, which can be disabling and putting him off the season. So these are the injuries which we are more concerned, and the small niggles and pains will be coming and going, and those can be monitored to know whether those are the signs for risk factors. So some of the key components to look into an injury prevention program will be your core training program, your neuromuscular control, plyometrics, and agility. So they will all be a progressive one or interlinked one which will manage your injury prevention. So if you look at the football, there are something called as the FIFA 11 Plus program. So this is a complete warm-up program which includes some agilities and strength training which can help an athlete prevent major injuries in football, which includes your ACL and hamstring strains. So the FIFA 11 Plus program is a program which uses proper positioning during all exercises. So it depends upon which position they play, and it gives you an information on what is the correct method and wrong method of the player exhibiting their physical skill. So for an example, we are looking at how a person is going to stand and try to move. So we are going to look at the body alignment. So if there is a alignment that is going off, probably the hip abductors are weak, and this can lead to your knee injuries with ACL or MCL. So this is a basic program which has about 11 exercises which can improve their overall fitness. So they have different parts in their program, which will include level 1, level 2, level 3, and they have all the components of running exercise, strength, plyometrics, and balancing. So they have warm up. How do you do? What are the ways you're going to do crisscross and run? So those things come into play. Then there is something called as functional movement screening. So this is a evaluation where they say how you can evaluate your basic movements of the body. So there are about 7 tests in this. Doing a deep squat, you do a hurdle step, and then you do an inline lunge, and then you have a leg rise, straight leg rise, shoulder mobility, and trunk stability, and push-ups. Now, when you do these tests, there are scores from 1, 2, 3. So you score depending upon how well they perform and in the right form they perform. So that will give you an idea if there is any abnormal movement or abnormal pattern happening in the body movement. So a sports-specific evaluation is going to give us a idea about if there is any risk or any abnormal pattern happening which can lead to a injury. So you can do a basic evaluation of your height, weight, girth measurement, your BMI, fat percentage, basal metabolic rate. You can do a flexibility strength test, aerobic capacity, agility test. So these are test components. I'm just giving an example, excuse me, which you can use into making a plan. Now, this is a simple evaluation test we have prepared for the football club. So we do this test to keep the scores, which will give us an idea how the planning is going on and how to monitor the players' progression. So evaluation, you have to understand there are 2 different components. Fitness evaluation is another thing and medical tests are another thing. So your medical tests can involve X-ray, MRI, blood test, special test. All those components will come in your medical test. So this can be more appropriate at the beginning of the season or when a player is having injury and is coming back into active sports. So once he is cleared the medical test, then you make him do a fitness test, which is more functional. So then you will know that whether the player is fit enough to start training and then plan for active sports participation. The next thing comes, how do you plan your training structure? Now in India, if you see, apart from the elite athletes who have exposure to good facilities and services, other people do not have a proper planning. So they are never screened, they are never taught exercises in the proper way. They just do things how they do on, and the warm up or cool down and the main phases are all ignored or unstructured. So when you plan a program for an athlete, you need to have these components in mind. You need to know the individual physical demand, what kind of sport and what level he's going to play. And then you need to work on what type of the intensity, the frequency, the progression, and overload. Now, all these components are to be kept in mind when you plan an exercise program for your athlete. And this is a basic understanding of your training calendar. So you can take a year calendar. In India, most of the kids who play have their calendar where it's the exam time and then the entire season and go. So we can have a plan from April, May to go to the next May. So you can ask the parents and the kid how they want to plan their training calendar. And you need to make a plan that this is going to be your off season or in season. If you play different tournaments at different part of the time, so you identify which is the important tournaments, and then you give them how they need to plan their strength training, speed, agility, and the sport. Then comes the micro planning. So how do you take your 1-year plan and break it down into months or 2 months program, and then divide them into weekly programs, and then hand over, and then you ask them to start following it up. So taking forward that component, the stages of child development. Now, these are the 5 areas of child development: cognition, your physical, speech, language, neurological, brain, and personal, social, and emotional state. Now, these are the 5 areas of child's development. Now, children who are less than 6 years, their basic motor activities are mostly crawling, running, jumping, simple throwing. They do not have any concept of gameplay, competition, teamwork, rules. They just do what they physically can do. Now, people from age 6 to 11 years, they have basically completed their basic motor activities. So they should be able to jump, crawl, all those things. Now, learning and thinking is focused on individual facets of sports. Probably if you know they are going to play football, now a little bit focus is going on to be more focused. Now, the personality features again is not stable over here. They can be different. Their personality traits are still not fully established. They are more impulsive. What they feel at that time, they will do. Their willpower is not so well developed, and their concentration level is also very less. And again, they have no difference between boys and girls component coming in. The kids from 11 years to 15 years, as they are reaching their puberty and coming into the growth, they can develop some amount of motor clumsiness. So you can have somebody who is throwing the basketball well, suddenly is not able to throw well, and all those things are happening. That is because of the changes in the puberty. The other things what they develop here is logical thinking, abstract thinking, and their emotions. Now this is where in sports they will be able to think logically sometimes to know, okay, I can play this way. I should not be doing this during my game. And their emotions of looking at winning, losing, and accepting defeat, these things started to come into play. And they start looking at the difference between the male and female. By the age 15 to 18, there is full physical development. The body is completely grown, and they have full capability of logical thinking and abstract thinking. And you will find that this is the age where we see a lot of players who has potential in the way they think, and they are touted to be future captains. So what can be done for kids? In India, what we see is sometimes a lot of kids participate in sports, and we get parents coming and telling, oh, my kid has got a tournament coming up. He has to be ready. He has been the winner in all these. He has to be doing these kind of things. So understand that for a kid at the young age, up to 6 years, what I informed before about the things, you can have a playground where they can just play about climbing up, jumping, running, sliding, all these kind of things can be incorporated. That should what we should be looking at. Now, age 6 to 9 is where you are at the fundamental stage. So you're going to give them about agility, balance, coordination, and you're going to give them an introduction into a sports. You can't expect them to overperform and exceptionally do well, but these are the areas when you will be able to pick up some of them. Now we need to introduce some simple teamwork, etiquettes on the field, and simple rules should be given to them. Probably, okay, this is your warm-up, how you need to do, this is how you need to maintain your hygiene. These kind of things should be introduced at this age. Stage 9 to 12 is where you build on the fundamentals. So if you have put 5 rules at that level, you can now progress to maybe about 10 rules or 15 rules. And this is an age, again, you can introduce them to different forms of games, and you can pick up which they are very good at, and you can start specializing on them. You can have team games where they will be used to team games now, and they will know how to work as a team. Again, this is an age where you introduce a structured program. So earlier what I said, that you can have a calendar for them and give them, okay, this is what you need to look at a 1-year program and micro planning. The fitness components has to be started incorporating with a proper plan, what is strength, how much they need, all those things. Nutrition guidance also can be started at this age. Training to train. Now this is a period of growth for kids where they are going to try and achieve their maximum physical growth as a body, and you can sometimes have, there could be an alteration in their flexibility, posture, techniques and mental capacity because of their growth getting completed. And this will be probably an age they would have specialized on one sport, saying that, okay, this is my sport, what I'm going to do. And this is where we should start introducing our fitness assessment as a protocol. The planned training can go up to the next level, and the actual introduction to competition is what at this level should be done. And the male and female participation and training goes separate, and the duration or the workload has to be monitored. So this is a video I picked where they had 2 kids from the school are just doing their gymnastic skill on the road, and this was on the Twitter, and the American Olympic gymnast tagged the video, and it had gone to the notice of the Indian sports minister, and they enrolled these kids into their gymnastic program. So why I say this is, we don't know where the talents are available in kids. Only thing is they need a structured program and some good guidance so that we can see results coming up. So coming on to the clinical management. So the first thing I want to put light on is the science, evidence-based practice. So if you look at science, just because we can't currently measure something objectively in an agreed upon way doesn't mean that something should be dismissed or ignored. Sometimes in sports, like let's say an example of Bumrah. If Bumrah was bowling, and if we are going to our textbooks and saying, okay, this is how a shoulder biomechanics should work or how a bowler should be bowling, Bumrah will definitely not be fitting into them. But we can see the skill, what he is able to do. So understand that protocols give us a rough guideline. So that's going to give us saying that, okay, this is how you need to work. And you need to work around them, understand them better, and then use them into our progression. We can't stick to a protocol which is a basic fixed protocol which you need to blindly follow. So that will not help when we are dealing with injury management. So I would like to quote some of my interesting areas. Now, price management is something which everybody knows, and we are taught right from the basic that wherever there is an injury, there is going to be a protection. We're going to rest the place, ice the area, compression is going to be allowed, and elevate the part so that we can have a better injury recovery. Now, the guy who developed or who coined the term, Dr. Gaby Merkin, he's the guy who termed RICE, rest, ice, compression, elevation, in 1978. Now, this guy has now gone back and tracked the hypothesis in 2015, saying that ice might be delaying the healing rather than helping. So if you see that, even now we practice the price and the RICE management very often, but we still don't understand that why this guy had to backtrack. Now his understanding changed because of the newer findings of the injury healing, what is happening at the physiological level. So his component of saying why it will delay is that the ice component is going to restrict the flow of the fluids to the injury part, which also carries the healing mechanoreceptors and the other receptors, which further delays the healing. So the idea is to understand that there is going to be an evolution of the injury management, and we need to take that into aspect rather than blindly following them.
Blood flow restriction is a fast-growing therapy to accelerate performance and recovery. A cuff, calibrated by technology, safely applying pressure to the arm or leg, reduces the ability of blood to be pumped back to the heart from that limb. It increases muscle oxygen demand, causing the muscles to work harder to produce a contraction. BFR stresses the muscle at weights where it normally would not be stimulated. So most people can increase muscle strength using much less weights than usual or no weights at all. When administered by certified skilled providers, BFR can help post-surgical patients, return strength to the elderly, assist athletes, potentially reduce the need for knee surgery, and much more. BFR is easy to use, hard to misuse, better for results, and above all, safe. Accelerate your patient's performance and recovery with the proven therapy of blood flow restriction.
So the blood flow restriction is one of the new concept that is evolving. Even though the concept has been there for about 40 years, but now scientifically people have been able to take this with a lot of research and have been taking it into rehab. Earlier, the same component was popular more with the bodybuilders, where they used to have a strap to restrict the flow, and this was a Japanese concept which was taken forward, and now there are very good results coming on to them. So what are some of the main components are? It's a very short duration one. You can use very light weights in this. They help in reducing the soreness of the muscles post exercise. The recovery is faster and the results are better. What are the research says? There is a significant increase in the growth hormone that is released from the body. There is less muscle damage, so there is shorter recovery. The increase in strength is good, even though you use very minimum weights. And there is improved function in both the age groups of younger and elderly people. There is cardiovascular benefits as well as bone density benefit. So the growth hormone changes, what they see with blood flow restriction and without blood flow restriction, is quite significant. So doing this is almost 25% more than your amount of growth hormone that can increase, which in turn helps you to improve the muscle bulk. And they have done survey studies, and they're saying that it is very safe until unless you know what are the guidelines you need to use. So these are some of the documented guidelines how you can use a blood flow restriction, where you can use it for various purposes, where you are using it for strength, you're using it for cardiovascular, and for your endurance. So if you see now, the blood flow restriction is slowly putting its foot in the patients who are bedridden, who are going into functional capacity, low load exercises to high load exercises. So they are using into all the components of our physical demand, right from injury, progression to performance. So this is something what we need to look up and look forward in the next 5 years, how they are going to be taking up our field in the physiotherapy. Now coming on to recovery. Now this is a recovery cuff, again, which is quite popular now among athletes. Earlier, the same concept was used in our TKR patients or low limb surgical patients, where it was recommended, where they would like to improve the fluid to be drained. So the same concept is used here, where the recovery is done by removing the metabolic waste after an athlete who has participated in a sports or a training session, so that they are easily flushed out and the recovery happens very quickly. So this is in the post-workout or post-game. So I'll just keep. So coming on to the recovery, the clinical recovery component is also very important. So that means what? How much duration is needed to recover after an injury. Now, this is your basic guidelines. Again, we need to understand that this is our normal physiological recovery based on a injury to a muscle strain, ligament sprain, tendon, bone, articular cartilage, and ligament graft. So they are depending upon what grade of injury they have. It might take weeks to months. So this is our still fundamental data, which will give us, okay, I have an ankle sprain, which is grade 1. So I will know that I will need at least 2 weeks to completely recover to go back to sports. Now you can be off pain in 3 days, 4 days, but to incorporate mobility, proprioception, and load capacity, you will need 2 weeks time. So like that, you have for various injuries, which will have from minor, moderate, and severe injuries, you can have a guidelines which will know that, okay, this is the timeline I'm looking at for complete recovery. Proprioception or neuromuscular control again is gaining a lot of popularity in the rehab of sports injuries. Now people have understood that it is not only the strength, but proprioception and neuromuscular control, which is quite important to have injury prevention as well as to recovery for our patients to get back to sports. Coming on to the infrastructure. So we do have now a lot of sports centers coming up with beautiful facilities and infrastructure, which an athlete can dream of 10 years before. This is the Padukone Dravid Center for Sports Excellence, which is based in Bangalore, which has got center for swimming, they have for badminton, cricket, athletes, and it's a 15-acre complex. And we have the Abhinav Bindra Targeting Performance Center. I think they have about 3 centers where they are the main goal, 6 centers, and their main is to improve the performance, rehab, and allow scientific-based training for athletes. This is a center called Aspetar in Qatar. I had the opportunity to be invited in Qatar for the for a rehab session for their staff. This is called as Aspetar. This is a 250-acre for specifically football, and the sports center is accredited by FIFA. So they have 18 football fields, 1 international stadium, 2 international hotels for the players to stay, and a hospital with gymnasium, fitness evaluation setup. Everything is there. Some of my areas, what I have looked up and I have known people who work there. Olympic Gold Quest is another organization which helps the athletes with their support system. And they have a team of sports physios, strength and conditioning coaches, individual sports coaches, and they support the players financially and help them achieve what is required in their game. Go Sport Foundation, again, that's a foundation again where you have a lot of international athletes are involved. Rahul Dravid is one of the advisor to the board, and they also have a lot of shining athletes in their board who help them achieve their goals. Coming into Tata Group, they have a very beautiful sports complex based in Jamshedpur. Pro Health Asia is a program, a center based in Delhi. Again, they have a team of sports physios who deal primarily with sports injuries. This is another friend of mine who has a sports center, a very small setup based in Chennai. So infrastructure wise, there are things moving progressively in India where we have lots of athletes who are shining better, and the combination of the team infrastructure and the athletic performance is making the market grow. Now coming on to technology, we have seen drastic improvement in the availability of the technology that is currently available for athletes to use in evaluation, monitoring, and improving their performance. So some of the equipments, what I am aware of, I'm just showing you, this is equipment called as functional line, where you can do a biomechanical analysis of our movements, and you can take an evaluation and then plan your exercise program based on that. Postural line, again, your weight bearing status, how you move about, all those things are done. This is again a stationary, dynamic and static balance base, where you can do a functional training to know how your body balances during sporting activities. Pelvic management is also gaining a lot in our current world of the core being the key component. D-wall, again, another technology where you can use them for feedback-based monitoring. Cryo chambers are used for recovery post your active participation in training or sports. Wearable technology is also gaining. Our common watches are now getting more and more updated. They are getting more, you can monitor your load, the amount of calories you burn, the distance you cover. So this is simple ones where many of them have access that you can use, and you have some advanced technology where they are wireless based, switched onto a computer, where an athlete can monitor, and teams are investing on these technologies now. The technology not only for monitoring, it is also expanding to the sports equipment itself. People are understanding the component of the equipments that an athlete use. So a badminton racket now has variation in shape and the tension that is used in their bat. So depending upon what kind of game the player is playing, if he is an aggressive player or he is going to play a defensive game, so the tension or the shape of the bat are now custom made based on that. So video analysis, earlier what we used to think was all about big cameras and all those things, but nowadays we are also able to use our smartphones to have better video analysis at a low level, but that still gives us a very good, and a lot of studies have been there on the high speed cameras plus our normal mobile based cameras. And all these helps in giving us a feedback which enhances the performance. So ultimately, if you look at the performance needs an evaluation, and that is how it is going to make us cover up those areas which are weaker. Looking at our career based, now this is the best time to start our career in sports. We have opportunities where sports clubs are ready to hire physios as a full-time or as a consultant. Sports academies which are specifically going to work on the athletes are opportunities for physios to tap in and use their knowledge over there. You can also become a consultant with the school or the college team, and you have a lot of the schools or colleges which invest on the athletes who come from the sports quota, and some schools and colleges are well known to produce good athletes. Being a team physio in leagues, earlier the understanding was the physios were usually either the foreigners. Now the Indian physios have taken over, and they are the leading physios with major teams in India. Some of the physios have also gone to be physios in abroad with other teams over there. There are opportunities now to be a personal physio for a sports person. So some individuals hire a physio as their own personal physiotherapist, and sports injury clinics are also gaining popularity now. So individuals can have their clinics well equipped just to treat only the sports injuries. So the take home message: understand an athlete is a challenging patient to treat. So he does not want to be near normal. He wants to be more than normal. So we always try to bring the athletes to a level better than his level. And if you see, a lot of the athletes actually after injury have started performing better because they have taken the scientific approach. They have understood their body. They have understood their risk factors. They know where they are weak, and they work on, and they outperform than their previous pre-injury level. Evaluate fitness and monitor load. This has to be key. Always educate the player on this, and you also have to have a look on that. Make the patient understand that all tournaments are not important. When the kid is starting to play, the parents want them to take to every tournament every month. Make them understand they need time to recover also. Introduce injury prevention program to every athlete you come across. Teach them that there is something you need to do that is incorporated along with the training. Technology is to aid your clinical skill. So understand, technology will not make you into a bigger athlete, but you will have a skill, or your assessment skill should be good, and your technology will only add to that. If you know how to biomechanically understand how a squat is done, when you add technology, it should be adding up. Not that you do take this video program and then you think your squatting understanding will get better. No, it will not be possible. You will have to sometimes work in a multi-role when dealing with athletes at lower levels. You need to add up a little bit on the strength and conditioning, maybe nutrition, so mental fitness also. So sometimes to have added information on all the nutrition, strength and conditioning, and psychological aspects helps you to push the athlete to a higher level far more better. So that's about my information, what I wanted to share. Thank you very much. I hope I've given you some kind of an insight into what we can look at physiotherapy in the near future.
Thank you, sir. Thanks a lot for such a, again, a very wonderful and outstanding session from your side. We learned a lot, and it is always a great learning when we join the session from you. So thank you very, very much. We are receiving great feedbacks in the chat box, and
Thank you.
we are really privileged and honored that you always support us whenever we request you, and you spare your precious time to share your incredible knowledge. Really grateful to you, sir.
Thank you very much. Have a safe day, and
yes.
Keep being safe.
Yes, we'll meet again at 1:15 with the next different Zoom ID for the next session on the Women's Health Physical Therapy by our international speaker, Dr. Swapnila Jacob ma'am. So you all please check your mail ID for the joining link. I have already shared it. If somebody has not received, they can even message me or WhatsApp me on my number I am giving on the chat box. So I'll provide you the link there. The feedback form was already there in the chat box. Please fill it. If you not have filled it till now, then only you will get the certificate, and anyone can fill it once. So if you have already filled in the previous session, there is no need to fill it again. Thanking you all the respected dignitaries, attendees who has joined us, and heartfelt thanks to the Ganesan sir for their wonderful and outstanding session.
Thank you.
Thank you, sir. Thank you, sir. Really grateful to you. Thanks.